It is characterized by the periodic occurrence of severe unilateral headaches. The pain is excruciating. Unlike the throbbing headache of a migraine, the pain of a cluster headache is described as sharp and penetrating. Unlike people with a migraine, who prefer to lie still, people with a cluster headache tend to move around during an attack. On the same side as the pain, there may be a blocked or runny nose, a red and tearing eye, a constricted pupil, and/or a drooped eyelid. Cluster headache is a clinical diagnosis, but because it can be caused by intracranial pathology, neuroimaging, preferably with MRI, is indicated when the diagnosis is made. The preferred therapy during an acute attack is oxygen, but if that doesn't work and there are no contraindications, then subcutaneous sumatriptan may be attempted. Cluster headaches are more common in heavy smokers. However, smoking cessation does not affect the course of the disease once it begins.